Hi guys. So today we'll be looking at the Step 2 CS patient note. How to compose and complete patient note within 10 minutes is about the most important factor to consider when going for the Step 2 CS exam. There are four sections of the CS patient note. We've got the history part, the physical examination section, the differential diagnosis section, and the diagnostic plan section. You'll be given at least 10 minutes to complete these four sections on the exam. Let me open the patient note template so we can have a better visualization of the various sections and how we can proportionate our time on the exam. Completing these sections within the time effectively and efficiently matters a whole lot. How do we go about this? I will start with the differential diagnosis, and I will have my first differential here, my second one here, and the third differential diagnosis here. Note that in some cases, you may not have the third differential diagnosis, and it shouldn't bother you. The important guiding principle is how many differential diagnoses would you have, and you've got enough history findings and enough physical examination findings to support. So having a third one with no finding may hurt you on the exam. After everything the differential diagnosis, I will go straight to the diagnostic studies. Recognize that I've skipped having the supporting findings for the sections here, the sections here, because there are some important points in the history and some important points in the physical examination that we basically will be copying and pasting all over here, all over here. In diagnostic studies for all pediatric cases, we'll have physical examination. This is because these cases are never brought to the exam center, so you want to take a look at them. For all OBGYN cases, we'll have either pelvic examination or genital examination. If it's a case of premenopausal, we'll also have beta HCG test to rule out pregnancy. It's important to state that in pelvic examination, we're taking a look at everything that's genital and rectal, while in genital exam, we're just focusing only on the genital parts. For all GI cases, we'll have rectal examination, and if we're suspecting GI bleeding, we also have the FOBT test. For all cases of depression, loss of consciousness, forgetfulness cases, and some cases of fatigue, we'll have mental status examination exam here. For all cases in general, we'll always be careful. We'll first start and stick with the simple, affordable, inexpensive or cost-effective tests, such as we have the CBC, TSH, electrolyte panel, X-rays, ultrasound, and etc. We'll be careful with very expensive tests such as MRI or invasive tests such as biopsy. We're always going to have these tests when it's very necessary, like in the case of headache for MRI, and we want to rule out cancer or examine tissue for biopsy. Now we've completed the diagnostic studies section. I'll go next to the history part. And for the history, most people like to use the common mnemonics right here. The most popular mnemonics is the Quora, and you might want to add something in front, DPF, to make it a little more complete, where you have the duration, progression, frequency. So location for I for intensity, quality, urinary symptoms, onset, radiation, aggravating factors, and associated factors. After this, we're gonna rule out differential diagnosis by saying no, or denied, or negative for whatever I wanna rule out. The next is to have the other associated history, and the most popular mnemonics almost everyone uses is the Palm Horse Force mnemonic, where the P is the previous episode, the past medical history, the past surgical history, A for allergies, M for medications, H for hospitalization, U for urinary symptoms, S for sleep, F for family history, O for OBGYN history, S for social history, and the other S for sexual history. Social history, basically, we're talking about soda, and in soda, we're talking about smoking tobacco, and occupation, and recreational drugs, and alcohol. Also, always remember diet, exercise, and living condition. And we've completed this section. The next is to go to the physical examination section. In physical exam, we would like to start with the general appearance of the patient. You want to tell us if they are in acute or distress or not. You want to talk about the vital signs, whether it's within normal limits or not. And you can go to the main system in question and have additional systems. Okay, you have another system, one more additional system, and you can also have another system. I mean, if we have got a case of the cardiovascular, you have the CVS system exam, you have the respiratories, and you're gonna have the extremities. If you've got time to spare, you might as well have a little abdominal exam. After you complete this section, the next is to start copying and pasting here, and copying and pasting here to support your differential. How much time do we need to spend on each section for the exam? I will spend 4 to 4 minutes and 30 seconds on the history part, and sorry, that's meant for the history part, and about 2 minutes for the physical examination section. We shouldn't spend more than 2 minutes here. About 2 minutes for the whole of differential diagnosis and their supporting findings, and we should spend about a minute for the diagnostic studies. So in all, we must have spent about 9 minutes in total, and we've got some few seconds to go over every section and make some quick corrections, and I hope we've made a good patient notes. Well, I wish you good luck, and I believe you're going to do well this exam. Please keep liking, keep subscribing to our channel, and good luck. Bye. Thank you.